Assalamu alaikum. Start with the name of Allah, the most gracious and the most merciful. Welcome you all to the International Brain and Biomedicine Conference 2023. My name is Shamsul Rehman. I'm a final year MBBS student at Liaquat University of Medical and Health Sciences, Jamshoro. Today, my topic of presentation is Association of Stress and Insomnia with Emotional Quotient among undergraduate students of LUMS. What is insomnia? Insomnia is defined as a sleeping disorder in which one may experience difficulty in falling asleep, staying asleep, or getting a refreshing sleep. Long-standing insomnia has prevalence of 10% among adult population. Temporary insomnia may be due to stress or changes in schedule or atmosphere, which can last for a few days or weeks. Chronic or long-term insomnia occurs 3 or more nights a week but lasts for more than 3 months. Insomnia has great impact on one's memory, concentration, and focus. Chronic insomnia raises the risk of health problems like blood pressure, diabetes, and chronic heart disease. Insomnia is a multifactorial disorder mostly caused by psychological stress. Medical students tend to experience great load of academic stress which lead to sleep disturbance. That's why insomnia is much more common in medical students. It's been found that stress and insomnia both have negative impact on emotional intelligence of students. The students who are having low EQ are facing reduced self-awareness, not good in managing emotions, not motivated always, no empathy for others, they have low social skills. These are the some objectives of our research articles. Number one, to evaluate the association of stress with insomnia. Number two, to assess the association of EQ with insomnia. Number three, to determine the association of stress with EQ. Our study was conducted at Liaquat University of Medical and Health Sciences, Jamshoro. Our study design was comparative cross-sectional study. Our study period was from 15 August to 31st October 2022. Our study population was the undergraduate students of LUMS. Our sample selection was through online questionnaire. Our sampling technique was non-probability convenient sampling. Our sample size was 167 students. The inclusion criteria for student was their age limit between 17 to 26 and the undergraduate students of LUMS. Exclusion criteria age below 17 or above 26 and the postgraduate students of LUMS or other universities were excluded from this study. The data was collected through online questionnaire. Regensburg insomnia scale was used to measure the level of insomnia in students. Perceived stress scale was used to measure the level of stress in students. Emotional intelligence questionnaire was used to measure the EQ of students. The data was studied and analyzed. All variables, including insomnia, stress, and EQ, were observed and compared through SPSS software. Moving forward toward the result section, we found that 57.5% of the students were found having insomnia. It means that the frequency of insomnia is much more common in medical students. The pie chart shows the ratio of insomniac students versus normal students. Let's discuss our main objectives. Association of stress with insomnia. By analyzing the data through SPSS, we found that a positive correlation exists between stress and insomnia. A significant p-value is 0.05. Look at the graph at the left. The students who are having insomnia are represented by green color, but the students who are having normal sleep pattern are represented by blue colors. According to perceived stress scale, stress is categorized into three groups: low stress, moderate stress, and high perceived stress. A certain degree of normal or physiological stress was present in both group of students, but those who were found insomniacs were having higher degree of moderate stress and high stress. The graph on the right shows 60% of the students who are experiencing more stress were found insomniacs as compared to those 40% students who are experiencing normal stress, so they have normal sleep pattern. Association of insomnia with EQ. We found that insomnia has negative impact on the EQ of students. A negative correlation exists between insomnia and EQ. A significant p-value is less than 0.01. Look at the graph here again. The insomniac students were represented by green color, while the normal students were represented by blue colors. Out of 96 insomniac students, 74 have low EQ, 18 have moderate EQ, and 4 have high EQ. It means that the students who are experiencing insomnia, they have low EQ. Association of stress with EQ. A negative correlation between stress and EQ was found A significant p-value is 0.01. Look at the graph. It shows that the number of students who are experiencing moderate stress or high perceived stress were higher in number who are having low EQ as compared to those who are having moderate or high EQ. So stress also has negative impact on EQ. We concluded that high level of stress impacts sleep pattern of medical students and it is important cause of insomnia. Furthermore, insomnia and stress both have negative influence on emotional intelligence that suggests they are the root of decrease in EQ among medical students. Recommendation. Unfortunately, poor sleep quality greatly underreported among students and there is widespread ignorance about insomnia in our society. Seminars should be arranged to spread awareness about sleep education and its positive and negative impact on health. Different seminar and workshops should be arranged to help them managing stress and tackling with difficult situations. Students should be aware of the importance of stress management. Healthy environment for students should be provided to flourish. Course a scheduled student should be student friendly. Further studies are required to find out other factors responsible for sleep disturbance. These are the some references which were used in our article. So this was all about my research work